real audience, but here we go. We're going live now. Hello, everybody. My name is Jake Leyland. I am the Misinformation Officer for Médecins Sans Frontières, and I'm delighted to be chairing today's Humanitarian Congress session entitled Getting Practical, How to Manage Misinformation Within Communities. So I will introduce our panel shortly, but before I do so, there are some housekeeping rules that I think we should cover, after which I'd love to pique your interest in today's topic with a few introductory remarks. So to the housekeeping, this will be a live stream session, so please be on your best behavior. And a few things to mention before we get going. There is live captioning available if you should need it. So please refer to the link in the reception area of the virtual conference lobby. And for any other questions, there's also a help desk in the session area as well. Finally, I'd like to invite all of you to share your thoughts or your comments on Twitter if you use it. You can use the hashtag HCBerlin. And you're also welcome to comment and post questions in the chat bar on the right of your screen as you see it. So finally today, I'm sorry to say that our panelist from the International Rescue Committee, Andre Heller, is not actually able to attend. And as a result, I'll be taking more of a hybrid speaker chair role. So I'll try to contribute some of the insights from MSF's work in regards to misinformation in the humanitarian settings. So without any further ado, I think maybe let's just remind ourselves of why this topic is being discussed today. So rumors, misinformation, and disinformation are all clearly adding to the dangers of the current COVID-19 pandemic. And I think places where all humanitarian actors are working, we can see that false, misleading information is either being deliberately circulated to cause harm or spread unintentionally, which fuels confusion and can also sow mistrust. And this particularly affects health workers. You know, we've been stigmatized and attacked, and there's a growing mistrust in scientific evidence generally, which underpins medical humanitarianism. But inaccurate information is spreading widely and at enormous speed due to some unprecedented features of the modern information landscape. So the advent of social media and huge levels of internet penetration are creating the conditions for a very convoluted information environment in settings that are already complicated by humanitarian emergencies. So understandably, this does make it more difficult for public to identify facts and to take advice from trusted sources, because the notion of a trusted source comes into question when misinformation spreads online. So, you know, this is definitely something we've seen as an organization. MSF operations in many contexts, including Yemen, Haiti, Colombia, Afghanistan, Cameroon, Somalia, the list really goes on. We've seen people reporting that health misinformation and rumors are increasingly affecting the health-seeking behavior of the communities that we are looking to serve, and also affecting the trust that people have in medical staff and institutions in those communities. So with all of this in mind, we're asking the question today, well, we're asking a number of questions really. So how can humanitarians navigate this polluted information environment? How can we identify and counter misleading information in a timely way? How can we break the self-sustaining cycles of misinformation that affect communities in humanitarian settings? And perhaps most importantly and relevant to this year's topic, how do we actively involve effective communities in building safer information environments, both digital and non-digital? So there's a lot to cover here. But, you know, humanitarians, policymakers, and researchers have all been involved in this very urgent question over the last 18 months. And in today's panel, we'll try to sort of oscillate between, I guess, the conceptual and the practical. So we're going to draw from the experiences of our two practitioners today who join us, who are very well versed in misinformation management. So it's my pleasure to introduce them to you today. So Azia Kambal, she is a project coordinator for the Rooted in Trust project in Sudan. Now, Azia works on understanding the role that rumors and misinformation plays in the COVID-19 pandemic to try to support humanitarian and media communicators so that we can listen and engage and respond to community information needs. And we also have joining us today Hanifi Kanaji. So Hanifi is the Accountability to Affected Populations Senior Team Lead for the Turkish Red Crescent Cash Platform. So it's a bit of a mouthful, but it's certainly an interesting job title, Hanifi. So Hanifi's expertise is on cash communication, community engagement, humanitarian coordination, cash and voucher assistance, and he's based in Ankara in Turkey. So we have an interesting balance between the health misinformation landscape, but also how misinformation can affect service provision in humanitarian settings as well. So yeah, I figured that maybe I could just kick things off by asking Azia a question and then Hanifi a question, and then we'll sort of meander into our discussion today. So Azia, yeah, I'd like to ask you from your experience in Sudan, why specifically is misinformation a problem worth tackling when it comes to the COVID pandemic?
Thank you, Jake. I'm really glad to be here. So misinformation is quite rampant in Sudan, and rumors around the COVID-19 pandemic. What we do here at the Rooted in Trust project, which is part of a larger global project, is dispelling misinformation and disinformation around COVID-19. And we do this by working with local media, local volunteer networks, local organizations, different initiatives, as well as, of course, public health actors and the humanitarian community. Misinformation impacts how we behave, how we carry ourselves during the pandemic, how we sort of adapt the preventative measures in our daily lives, and also how we protect ourselves and protect our communities. Misinformation cannot be disconnected in Sudan from what's happening, for instance, in terms of the economy. There's high inflation, prices are expensive. There's also, Sudan has undergone a revolution and is currently in transition towards democracy. So there is a political transition. So we can't disconnect how people are looking at the pandemic from what is happening within the context, within the country, politically, socially, economically. For instance, when first cases, COVID-19 cases were registered in the country in March 2020, the government introduced a lockdown, and the country was pretty much shut down for about 4 months. The reality is most Sudanese people rely on their daily income to survive, to live. And when they've been cut off from seeking their livelihood, then they're more insecure. And so you heard often people saying, if COVID-19 doesn't kill me or defeat me, then hunger will, because I'm sitting at home and I can't access my livelihood and I rely on my daily income. And so then you start with, this allows space for or room for misinformation, for rumors to circulate, and for people to start to perceive the pandemic from a point of view where they want to lock us down, they want us to stay at home because they don't want us to go out and protest. They don't want us to express our views. And so here at Internews, we feel that misinformation is telling us a story. It's a way what people say, community perspectives, their concerns, their questions, their hopes and fears during the pandemic are really telling us a lot about what they're thinking right now and what they're feeling, but also the gaps in information. What are their information needs? What are their COVID-19 information needs? Rather than us having sort of preset messages or a specific agenda we want to pass. That's not the case. We like to listen to communities and kind of understand where they're coming from and what they're looking for. And we feel that information, I think at this point in the humanitarian sector, we perceive information as also a humanitarian need. And information during a public health crisis can be life-saving. So that we work in parts of the country that are impacted by armed conflict, or with communities that are affected by displacement, or marginalized communities. And so in some parts of the country where people are living in remote areas, access to information, constant and fluid information, can become interrupted. And so we have this assumption generally within the sector that people know about the pandemic at this point. But this assumption could be flawed. We are assuming this because we're looking at it from sort of our perspective. We're more privileged, but that is possibly not the case. So I'll hand it over to you, Jake, and I'm sure we'll have more time to discuss this. Thank you.
Thanks very much, Azia. Yeah, it's very interesting because you draw on these sort of key points like community feedback, perceptions, local realities. I think we'll definitely come back to later on in the panel, because these are really, really essential components to the misinformation landscape as it affects humanitarian settings. So thanks for that. It's really great to get your introductory remarks. Yeah, Hanifi, so turning to you now, someone with a slightly different focus, perhaps a slightly more technical role. I'd just like to ask you to kick things off. So have you seen a change in how misinformation affects the populations that you are working with since you began work with the Turkish Red Crescent? Has there been a shift in how this affects them? Thanks.
Thank you, Jake. And also it's glad for me to be here to find this opportunity chance to share with you my technical and practical information regarding the Turkey context. But before that, maybe it could be useful to provide a brief picture from the Turkey context, especially considering the humanitarian perspective. Actually, currently, there are two main issues in the country, in Turkey. One is the refugee crisis, which is not something new, because since after the outbreak of the Syria civil war in 2011, a migration wave happened to the country increasingly, and now Turkey is hosting the biggest refugee population in the world, which is over 4 million, and from the different nationalities, and including and especially Syrians are the majority of this group. And the another issue in the country is for sure COVID-19 pandemic. Uh, Understanding and the awareness of this COVID-19 pandemic, there is a rapidly evolving, but also still there are some information gaps and the information needs among the community members. So I've been working for Turkish Red Crescent since 2016, and mainly we are focusing on the management of the misinformation, especially programmatic misinformation or the rumors. So at the first stage, we were dealing with the misinformation rumors specific to the refugee community, because they are minorities and they are in the country and they are sharing the opportunities and the livelihood opportunities of the local community. So always we face or we hear from the media, the social media, regarding the hatred and the other negative behaviors among to the refugee community. But in Turkey, again, in March 2020, first positive COVID-19 case recorded in Turkey. From that time, then the type of this remorse, this misinformation changed. Now it's not about the refugee community, but it's about the COVID-19 pandemic. And at the first stage, we captured some misinformation or the remorse regarding the denial of the COVID-19. And, in the course of this COVID-19 period, after the special vaccination, then we started to capture some misinformation and the remorse regarding the vaccination. So there happened a change uh, among the population, starting from the refugee community, remorse, misinformation specific to these minorities. Then with the evolve of this COVID-19 pandemic, then this trend changed to this related COVID-19 misinformation. Over.
Yeah, thanks very much, Hanifi. I think that's really interesting what you say, because obviously this kind of reflects Asia's point about how misinformation tells the story of the community in which it's circulating. And I thought, Hanifi, maybe could you just elaborate a little bit more on the specific mechanisms that you're using to kind of listen to the community? Because we had a very interesting conversation last week about how I think you have an SMS system. You have operators speaking in multiple languages, engaging with people seeking humanitarian assistance. So I'd really like to hear a bit more about that from you, if that's okay.
Sure. First of all, let me say, for any community, such rumors or misinformation specific to the refugee community or any rumors around the COVID-19 pandemic, if those are not identified and responded timely, they can create social tension. And it's really relevant ground, fertile ground for the countries like us, the hosting the many refugee communities. So this can provoke the negative behaviors and lead to harmful practicing and suffering, anger, social tension, thus capturing all those remorse and suppress them with the accurate, timely, life-saving information through the most effective channels among the community members has a vital role. As a national society with an auxiliary role to the government, Turkish Red Crescent is hosting many humanitarian projects in response to refugee crisis and the pandemic. Today, I'm going to share this practical information and the experiences of remote tracking and the management system established as part of the ever greatest cash project in its history, implemented by the International Federation of Red Cross and Red Crescent Societies and Turkish Red Crescent. Why I say this is the ever greatest cash project, because we are serving 1.5 million beneficiaries under this program. We are providing regular monthly basis cash assistance to those people. So any remorse, programmatic or COVID-19 based, are quite crucial, important for us to capture. Otherwise, it could result unintended outcomes on the ground. As you said, rumor, it could be misinformation or disinformation. With intentionally or without intentionally, it could be this incorrect information spread by the people among the community. So in Turkey, to catch, the logic, the aim behind this establishment of this remote tracking and the management system is first to capture the programmatic remorse, which are this is a cash program and we are providing the regularly monthly basis cash assistance. So this programmatic misinformation or remorse are mainly about the transfer value, program eligibility criteria, project life cycle, lifetime. So also we are trying to capture the social issues. At the first stage, we were mainly focusing on the social cohesion related remorse, but after the appearance of this pandemic, then also we collected and captured some pandemic related remorse. So this remorse, as part of the integrated comprehensive complaint and feedback mechanism, we established this, and we are collecting all these informations, different types of informations, through the all available communication channels, including the social media, website, call center, and face-to-face approaches. Under the face-to-face approaches, I can say, as Turkish Red Crescent, we have field teams on the ground, our service centers to receive the application to the program. We have outreach and the referral field teams, and also monitoring and evaluation field teams. Also, there are really great functioning coordination platform, humanitarian coordination platform in the country due to this refugee crisis. Also, we are trying to collect the feedback or any misinformation rumor through these coordination platforms by the external partners, stakeholders, humanitarian actors, or the other agencies. So these are the external ones. Actually, these systems consist of five components. First one is the collection of feedback, including rumor and misinformation, which I already mentioned, this online channels and the external channels. The second is sure verifying all these rumors, because before it is possible to respond a rumor, it is necessary to verify the facts around this matter and to uncover possible causes. Understanding the background of a why rumor has come up will help to decide whether it needs to be addressed or how it can be addressed most effectively in a more effective channels. So this verification involves the triangulation of all available information around this matter and finding out what triggered rumor, such as any unusual event like a pandemic among the affected population or general community, a recent change in our program, or any confusion about the information that was provided by us as the program stakeholder. So after this verification process, verifying the rumor, then analyzing this rumor is important. We have a data analyst in Turkish Red Crescent. We collected all these inputs in a master data file, and we are translating to in one language, which is Turkish, because our data analyst just working on Turkish language. But by protecting the original version of these feedbacks, especially remorse and the misinformation regarding this programmatic or the social issues. So we are categorizing all these remorse, and daily basis we are checking all this collected feedback, because some remorse you need to be act very fast. It could create unintended results among the community. Then also, after this analyzing process, we are deciding which channel we will be responding this remorse. And to respond, which is the next step of this mechanism, we have different channels to deliver the key messages regarding this misinformation rumor. It could be a specific region or overall community members. We use the different sort of channels and the materials. The first one, as you said, we have the bulk SMS sending system. We can clear we can provide the clear and the key messages through this SMS sending. Also, we have social media posts, and we have some pop-up messages on our website, program websites. Also, we can distribute these messages through the online platforms, because among the special refugee community, they have their own online platforms, and we are in contact the owner of these platforms, and we can use these platforms to distribute those information. And of course, engagement by the National Society, Turkish Red Crescent field teams, monitoring and evaluation and the outreach, and also information updates in our service centers, because daily basis those people are visiting our service centers to apply or to find answer for their questions. And also we can produce and distribute some short videos, of course with the verified information, because there are many wrong things considered as true among the community, the local community, regarding about these refugee communities. So we produce short videos with this verified information. Sure, the other option is the printed materials, brochure, posters, leaflets we can produce and distribute. And also we can provide the updates in the partnership of the stakeholders and the service providers. And as I mentioned, there is a really good functioning and coordination platform in Turkey specific to refugee crisis. So we can also share true, accurate information through this coordination platform. This is the overall cycle of this system that we use, this remote tracking and the management mechanism.
Yeah, thanks, Hanifi. That's is really interesting, and you've really gone into a lot of detail there. And so I think that some of the components of what you've discussed, I would really like to touch on in a little bit, because some of my work with MSF is sort of in the same area. But I wanted to draw a link between what you said about the kind of response component and engaging, like returning to communities with kind of, you could say, fact-checked, analyzed information that is shared either by video or printed materials or social media, and sort of link this a bit to, first of all, there's a question about working with media organizations, but also with what Asia does, because I think that the actual media environment in different contexts obviously has a very crucial role on how people interact with information. If internet penetration is really high in one context, then perhaps viral misinformation online will have a more significant impact on a community than it would do if internet penetration was quite a bit lower. So with that in mind, I'd like to ask you, Asia, when you go back to communities, having done community consultations to work out how somebody feels about, say, the COVID pandemic or something, do you use local media organizations? Do you engage with them, or do you kind of let them take the lead? Do you design responses, or is your work more about the listening component? So we've seen how Hanifi says there's a very sort of systematic approach from the Red Crescent, but is yours? Yeah, could you elaborate a bit more on your response mechanism too?
Yeah, of course. That was really interesting, and I think there are some parallels between what Hanifi does with the Turkish Red Crescent and what we do at Internews. Of course, the emphasis of the Rooted in Trust project globally is to focus on communities' perceptions and perspectives by listening first. So first, we listen to what people have to say around the pandemic, how they feel, what are their perspectives, whether they're based on misinformation, whether they're based on facts, whether they're based on emotions. We find that a lot of rumors can be, you find at times that rumors coming from a place of fear, people being afraid of the pandemic, that this being something new, unprecedented in a sense. And so there's this fear of how this could impact us personally, how it can impact my loved ones. And so this kind of fear we found fuels also the COVID-19 hoax rumor. We also find rumors that are coming from a place of hope. For example, we have dark skin, or we are Africans, or we are Muslim. So the pandemic cannot impact us. COVID-19 cannot hurt us. And this is also feeling this discomfort, people wanting to be comforted as new information is coming in about the virus, about the pandemic. So we listen through, we use two ways to do this. On social media, of course, through social media listening and following people's conversations online around the pandemic and the vaccines, of course, and as well through face-to-face discussions in listening groups where team leaders pose about just open-ended questions around the pandemic, and they listen respectfully. So the key is to listen without mocking people, without making fun of them, but being respectful to their views and perspectives and questions and concerns. And for us, it's really important not to impose an agenda. Of course, there's this idea, and of course there's value in that, in having uniform public health messaging, such as on the preventative measures. But we as humanitarian actors and public health organizations and stakeholders, we're passing the same messages. This could also fuel some kind of distrust, as if there is some conspiracy or trying to tell us what to do. And we understand that people don't want to be told what to do. And this is not unique to Sudan. We find parallels between how people are receiving information, for instance, in Afghanistan, in Turkey, in the US, in the UK. There are parallels and there are similarities and differences, of course. So the idea is to allow the community they set their agenda. We respond to their COVID-19 information needs, and we respond by also offering verifiable information. I'd like to give an example. This is a bit of a sensitive one, and we found this kind of perspective or perception circulating in Sudan, in Afghanistan, in India. Some community members saying that wudu, the cleansing ritual, the Islamic cleansing ritual, which Muslims carry out 5 times a day before prayers, protects people from a COVID-19 infection. So we respond to that in a way. First, we acknowledge this is an important purification ritual for community members, and people see this as a really important preventative measure, and it's close to their hearts. But we also offer additional steps that people can take to protect themselves. What I'm saying is, essentially, there's not one message or one way of addressing community concerns, misperceptions or confusion or rumors around the pandemic, but we have to contextualize it. Otherwise, if we just borrow the messages that are coming from the WHO or CDC, we're copy-pasting that without really being considerate and sensitive to the context, to people's own belief systems and cultural norms. And that's really important. And that is also, we found through our research, we conduct something at Internews, it's called an information ecosystem assessment, which brings me to the engagement with local media. This assessment allows us to understand the preferred communication channels, where people go to seek information, and it's not a uniform thing. You find one family where one person likes to listen to the radio, another likes to look for information on social media, another person gets their news through word of mouth, discussing with their neighbors, discussing with their loved ones, with their best friend, with their dad, etc. So there is this diversity within one household, and this diversity is found within the community. The idea is, once we do this routine tracking of rumors, of community feedback, perceptions, questions, and we respond to them through what we refer to as the rumor bulletins. And one of these bulletins is for media practitioners, for journalists, and we highlight what are some of the risky, problematic rumors, high risk in terms of kind of posing a risk to people's life and well-being, like take an aspirin every day and that will protect you from a COVID-19 infection. There are different high-risk rumors, or drink Clorox or drink bleach and that'll protect you from COVID, or that's a cure for COVID. So we through these bulletins that come out bi-weekly, we alert the media practitioners, hey, the FYI, this is what the community is concerned with, and these are some resources of how you can respond to this. We also have peer-to-peer groups with journalists supporting each other and discussing issues around the pandemic, around misinformation and disinformation. And we also offer story grants. We understand that in a lot of parts of the world that there are financial constraints that are impacting journalists' ability to kind of tell a story. Adding to that, in a humanitarian setting or a country or region that's impacted by some form of humanitarian crisis, we find this tension or mistrust or caution from humanitarian practitioners, not wanting to give sources too much information to the press, these concerns of the instrumentalization of disinformation. And so then we try to also build trust between these two communities, between the humanitarian community and the media community. And the idea is the media has a role in closing that feedback loop. The media has a role also in responding directly and imparting two-way communication. And with this kind of, and it's not only the media, but it's across the sectors, the humanitarian, the different local community actors that are influential, for instance, neighborhood committees or religious leaders. It could be individuals within a specific community that people respect and love to listen to. It could be a comedian, etc. The idea is to link this, to create this wider space and wider community, and to use these assessments, the findings of the information ecosystem assessments, also to inform our programming. And to build on. It's not a stagnant thing. No, these are our 4 local partners, or these are our 4 Sudanese partners. We work with these organizations, but we are linking together. Also, we're working with this volunteer network. We're working with this Sufi circle. We're working with this church. And we're sharing information and kind of encouraging people to dialogue with each other, but to continue this dialogue with the local communities as well.
Thanks, Asia. That's really interesting, and I think that lots of internews methodologies and insight has been actually really quite useful for MSF as an organization, at least with regards to the project I'm working on, because we've used the idea of an information ecosystem assessment to kind of to imagine how perhaps in the future we might be able to better understand the local information context that we're working in, and also be more effective in closing the feedback loops between communities and institutions. And I think that this is something that humanitarian organizations have had a lot of trouble with in the past. And I think that from our experiences of using, we're essentially, we've set up a kind of, it's not a monitoring platform, but it's a space in which really MSF staff can get together to discuss key issues of health-related misinformation, to then sort of dig deeper into those dynamics and work out, okay, so why, for example, might a community be talking about mask use a lot? Why might people not be trusting masks in a given community? And then to bring different profiles together around that information to then think, okay, well, actually, this is the link between low mask uptake and some other factor that's happening out there in the socio-political reality of a humanitarian crisis. So yeah, it's really inspiring hearing more detail about how those methodologies are used on the ground in Sudan. And I actually wanted to raise a question that was, I think it was brought up in an earlier session today, but it was a question about the misconceptions or the misinformation around COVID that is actually believed by women in different countries? And is there anything specific to gender that we can touch on in this phenomenon? I mean, that's kind of an open question for either you, Asia, or Hanifi. Thanks.
Hanifi, would you like to go first, or I'll go ahead? Okay, thank you. Actually, something really interesting is that we wouldn't have really known if we hadn't conducted the information ecosystem assessment. So in the first phase, we're now in the second phase of the project. In the first phase of the project, there were 7 countries. The information ecosystem assessment revealed issues of or challenges to women's access to information linked to gendered spaces. For instance, in some parts of South Kordofan state, which is in the southern part of Sudan and has been impacted by armed conflict, when there are gatherings or when humanitarian organizations come into this community and want to have a discussion, or public health actors, women don't attend these meetings. Women have separate spaces. And so what happens is the discussion takes place with the men, and then women are left out of the discussion. And so women have to rely on men to pass on that information. So with the listening groups, or using listening groups to sort of capture community feedback and community concerns and hopes and fears during the pandemic, we're considerate to this factor that there are communities. Sudanese communities are very diverse. In some we can have a mixed group, and then in other spaces we'll have to have these gendered spaces, only men, only women. But it's important to recognize this and ensure that that gender mainstreaming is happening in our programming, and that we are sensitive to this, because if we don't share this information with women in the community or part of the community, it could be people with disabilities, it could be older people, are not included in the discussion because of mobility issues, or because no one told them or helped them come to the location where the discussion is happening. We have to create, as humanitarians, these spaces. We have to be sensitive to this and not take the easier option. When we can, we need to, and when possible, we should be adapting to these kinds of situation. Now, what we found in this particular community in South Kordofan, because the communities of South Kordofan are also quite diverse. So what we found is women rely on social media to get information. They also listen to the radio to get information. The men read the papers, and so the women rely on the men to inform them. But when women have the opportunity to listen to the radio or seek information through social media, it's there. And this is all about responding to people's COVID-19 information needs or general information needs in the platforms that they prefer, also in the languages that they prefer. So there's it might be there might be 1 or 2 languages or 3 languages in a particular country that everyone uses, or we think everyone uses, but that's not the case. And so then there are parts of the population or the communities that we are trying to talk to and to have a dialogue with. They miss out on getting this information because the information is centralized in one language. It might be centralized in one area, and these are all considerations and really important really important issues that we pay attention to, because they can impact our reach, and most importantly, you can't have a conversation with people if you don't speak their language. You can't have a conversation with a community if you are neglecting a part of the community. So it's really important to pay attention to this. There are also rumors or misinformation that comes up that that are a bit gendered. For instance, people saying that COVID-19 doesn't impact us because we have been breastfed, but people living in Western countries have been really hard hit by the pandemic because their mothers didn't breastfeed them. So there's different stuff like that, but in general, the misinformation, it's not specifically it's generalized across the communities and different groups in the community.
Yeah, thanks, Asia. I think that there are some really interesting issues to unpack there, but I think the one thing I wanted to get back to, maybe, and Hanifi can touch on this, is like just the idea of language, because obviously, you know, we're all sort of communicating in a given language, but the structures in which the modern information environment have been built, and by that I'm pretty much referring to social media, digital technologies, very much centered around the English language. And for minority languages, obviously there is nowhere near as much fact-checking capacity on these significant platforms like Facebook, etc. But as a result of that, I wondered, Hanifi, if the experience that you have from your project, and because you talked about how you have this sort of data analysis component to your work, if you've seen how, for example, people speaking Arabic from the Syrian refugee population have either been underserved or misserved when it comes to correcting misinformation that they have about given services, or is that something that's impacted your project?
I mean, the Syrian refugee population number in Turkey is a huge number. It's the more than 3.5 million. So, I mean, Arabic language specific to those people is provided, served by the all humanitarian actors on the ground. Also, from the government side, mainly the official entities, governmental entities, Directorate of the Migration Management, Interior Ministry, and the Director of the Citizenship Affairs, Registry offices, all those buildings, they are also providing some materials in Arabic language. Also, sometimes government publishing, broadcasting, and some, the accurate information, the true information about the refugee communities, which are misperceived by the host community in Arabic language and in Turkish language as well. So it's difficult to say there happened any misserved or disserved regarding this language issue in Turkey, because I mean Turkish and Arabic totally different languages, and these people arrived to country, so it is unfair to expect they understand. That's the reason all governments and the other organization providing the Arabic language relevant materials. And also there are some vocational language courses on the ground to encourage them to learn the Turkish language. But as I said, Arabic materials for those community are available. For our specific project, for example, under this Emergency Social Safety Network program, we are providing cash assistance to 72 different nationalities. Those people living in the country, Sure, the Syrian are the top one. After that, Iraqi and Afghani people follows them. Iraqi and Syrian, they have the common language, but for the Afghani and those people, they use the Pashto languages. So also we are providing the Pashto language information to those people. And I also touch upon about your first question that Aja also mentioned regarding this: what are the misinformation, misconceptions among the women? For Turkey context and our experiences and our, the analysis, it is really difficult to say these are the misinformation or the rumors among the women, because since the last March 2020, we collected more than 1,200 feedbacks. When we check the gender breakdown of this feedback, we can say roughly same, male and the female. But regarding the especially COVID-19 issue, we collected very interesting feedback. I'm not sure what are the situation in other countries. For example, at the first stage of the COVID-19, before this vaccination, we heard that people saying, there is no coronavirus. It's kind of denial of this COVID-19. And also we heard that like lemon, onion, olive oil, garlic can protect you from this virus. This is the feedback or misinformation. Some certain foods can protect you. And also it's interesting, we heard that locals are not infected by this virus. And also we captured some virus is a chemical product. These are the before the vaccination. So during the time, into the course of this COVID change, after the especially vaccination, then we captured some misinformation like vaccines are not safe. They increase the risk of heart attack and they do not protect you from the virus. Such cases regarding the questioning, especially safety, reliability of these vaccines. These are the actually rumors, misinformations that we captured in Turkey context. But it's really difficult to say this is, the higher dominant among the women. But these are the rumors based from the refugee community.
Yeah, thanks, Hanifi. I think that your point about herbal remedies or local cures is really interesting, and it's something that we've been thinking about a lot, because obviously, dare I say it, like if a community or if someone's saying ginger root powder actually cures COVID, then instead of going and saying, well, this is just misinformation, what's true is that vaccines, isolation, and masks cure COVID. As I said earlier, that really tells you something about what people are turning to as a kind of a way of dealing with the symptoms of the disease when they don't actually have any other information perhaps available to them because of the local information dynamics. So I think what that's making us feel, perhaps as a group of people within MSF dealing with this, is that the community feedback component is actually the most essential component of all of this. So that when people are saying things like masks make me feel sick because masks spread COVID, instead of just de facto saying that's misinformation or that's a rumor, we're trying to work harder to be like, why are people saying that, and how do we engage with that information? And I think that this brings us round to, there's a really interesting question here, which Tina's posed, which is, can anyone please share serious collateral damage for your organization or project faced as a result of misinformation and how you manage it? And Hanifi, you've said that you can't necessarily touch on a specific piece of collateral damage, but I wondered, Asia, if you, in your experience, have anything to share when it comes to how misinformation has affected the deployment of your project or your work specifically, like as either as a result of misunderstanding or as a result of poor explanation with communities. Or
I don't have I don't have a specific example in terms of collateral damage, but there was a particular challenge. So for on the ground rumor tracking, we work with a number of organizations, but the leading partner on this is YPR Sudan. So they're a youth collective, and they're You can find them in the 18 states across Sudan. And when they had started this activity, the team in West Darfur had started right after displacement happened. There was intercommunal fighting, and as a result, people that had already been had been displaced became displaced for a second time, or even a third time. And so they were going in, talking to the communities, trying to start discussions and conversations within these listening group platform, which basically is includes about 8 to 10 people, and usually 2 to 3 guiding the discussion. And so when they would ask them about, so what are your views on the pandemic? Just kind of open-ended questions to get people speaking and describing their concerns and their perspectives. They were like, why are you talking to us about the pandemic? We don't want to talk about this. We've just been displaced. We have other humanitarian needs. And so that was really important. So the way they kind of, what they did was offered them that space, not allowed, but offered that space and listened respectfully, because people have just been displaced again, and they're looking for their families, they're looking for their loved ones, they need to find clean drinking water, they need shelter, and so they listen to them. And although this project is very much centered around community feedback around the pandemic, we welcome other humanitarian feedback, and that is noted and is shared with, of course, it's referred to other humanitarian actors to take action, and this is across all of our projects. Also, another issue on linked to trust was initially in some parts of the country, communities being a little bit hesitant, especially going through war and displacement and the impact of that, and having different actors coming in and interviewing you or wanting to hear about your experiences. And so something that they had noted that was different in one of the states was, we didn't think you were coming back. So when we were doing the listening groups and also the data collection, so YPR was involved in the data collection for the information ecosystem assessment in Sudan, they came back when the report was out. They went back to the communities and they shared the findings with the reports, and they had events around it. They used the findings of the report to pass the information in the community's preferred channels of communication. So there are certainly challenges, but there are also ways to counter that and to respond to that.
Yeah, thanks very much, Azia. Yeah, sorry that I've been jumping in and out. There seems to have been some signal issues.
Jake jumping out again. I thought I would have the problematic connection.
Yeah, I lost him as well.
Yeah. Maybe, yeah, so I hope Jake comes back, but I think this was really an interesting discussion and about trust and about misinformation, about involving communities more closely, and about looking at the science as well, but also acknowledging that people have their own systems and their own coping mechanisms, and being respectful to that as well. Hanifi, I'd like to give you a chance as well to share any last words, messages before we close.
First, I want to thank to HC Berlin just to provide us this opportunity. As much as possible, I try to provide our experiences, our practical information on the ground from the Turkey context, from the humanitarian perspective. And as I said, we are focusing on the refugee community, and we are dealing with the misinformation, especially programmatic issues. So this is a little bit different from the COVID-19 context around the world. But in the end, in Turkey also we collected misinformation and disinformation about this COVID-19 pandemic. And as your example, um, these rumors is the natural response of those people who face the many challenges. I mean, it's quite important to capture and provide the effective, accurate response to those. I hope we contributed a lot on this way. Oh,
Definitely.
thank
So,
you.
such amazing work. Keep up the great work, and let's remain connected. I think we can learn a lot from each other's experiences. I certainly learned a lot today from you and Jake. So I think maybe we agree that a healthy level of mistrust and misinformation is actually helpful,
Yeah,
and giving that space for communities to share is important, because then we're really responding in to what to their information needs rather than passing our own agendas. And I think that also frames our response in a more dignified manner. um, Jake is back. Just wanted to thank everyone for joining us today, and wanted to let you know the next session follows up in 1 hour, and it's about addressing the social determinants of health. So please tune in. Looks very interesting. I wanted to hand it over to Jake, but uh, too bad.
we
So
lost him again.
yeah, thank you so much. Thank you for joining us. And I hope we can have more of these discussions in the future. So Jake, why don't you close
Hi,
over?
everyone. I'm so sorry about this. Asia, you've done an incredible job of closing for me. So not only have you been a speaker, but you've been a panelist and a chair. So yeah, thank you very much, everyone. This has been a really fascinating conversation. We can take this offline. Our details